Pancreatic cancer kills 9 out of 10 patients, and when diagnosed, patients have months, not years. I use this analogy that immune system is like an army. In cancers like leukemia, the army knows the cancer is there and started attacking it. While in pancreatic cancer, there is no army to begin with because they don't know that the cancer is there. So we use a combination of different treatments to first activate this army and then help it continue the fight. What we are doing in University of Wollongong is to develop a biocompatible implantable polymer that can be loaded with multiple immunotherapies, and it can be inserted right next to the tumor and release its content, where then its content can activate immune system locally and avoid all those systemic side effects.
I think Elahe brings something quite unique. She brings a lot of passion, a lot of drive to the project, but in addition, she's very aware about the need to translate this from the bench to the bedside.
This research is proven to be very effective in the lab, and our goal is to take this into clinic where it can give the pancreatic cancer patients more time, more quality of life, and more hope.
Beyond the immediate impact on treatment outcomes for patients, we see that it might also impact the hospital system, so the treatment time, and reducing palliative care time for patients as well, so reducing the overall burden on the hospital and healthcare system in the future.